In a typical pathology laboratory, there are many so-called assets that need to be identified and tracked. Within the pathology laboratory, glass slides could be considered an asset filled with patient specimens, tissue blocks, and lab test orders.
Often these slides can be difficult to organize, evaluate, and keep track of when there is only handwritten documentation of the slides. This is a serious situation that needs large consideration due to the potential risk factors involved. Factors include misdiagnosis due to unorganized files, more mismatched labs, limited workflow, and mislabeled errors.
A promising solution to reducing the risk factors involved with laboratory results is a barcoding technique. Barcoding techniques have been recently tested and proven to show improved automation, efficiency, traceability, and patient safety.
I have asked both of you to meet with me today to discuss the barcoding system. Josh, why do you think this specific system could improve the histology laboratory environment?
Well, when I think about the system within a laboratory setting, I can see many different potential advantages. The introduction of barcoding helps alleviate downstream specimen and paper mismatches and for manual key entry of the case number and other details into the LIS. The barcoding systems also allow for fewer mix-ups occurred when printing barcodes directly onto the tissue cassettes. As well, the efforts should increase efficiency and decrease any labeling errors. Workers within the laboratory will also see the system helps drive protocols and standardized workflow. Lastly, one major change the histologists will see is the faster turnaround times of lab specimens. Now, Miranda, how has the system been taken? Are there any initial concerns you and your team have seen with the system?
Well, I was originally resistant to what the vendors were trying to accomplish. Barcoding is a recent strategy, and I was very hesitant to compromise the abilities of my workers and present methods and capabilities. The project began to escalate in costs. There were also an increased amount of project delays. I needed to know why the project was so expensive and why it was taking so long. The system before was not an issue or necessarily needed to be changed. Jessica, how do you find using the new barcoding system?
Well, prior to implementation, I had received tissue specimens with handwritten labels accompanied by paper requisitions with patient details and physician instructions. I then had to manually enter cases or record them into the lab information system after being assigned a number. However, when Miranda came to me about transitioning to barcodes, I was very opposed. Several trials had to be required due to the balance within the label and the font size constraints, as I wanted to keep the same information on the labels. Although the barcodes could quickly open up correct patient cases, a compromise needed to be reached between employing a robust and scalable barcode that was still readable. This caused my work to take much longer to complete because I was being forced to work with only one case at a time. The production of making labels would require extra time and effort, causing delays in my workflow, plus the potential of an internal error to occur was at risk. Although there was potentiality with this system, it was unable to work in this environment. How do you think you might produce a similar working system in the future, Josh?
Well, I know this time we had a limited ability to integrate the barcoding solutions into your histology lab, so I really want to work on that next time. I also want to make sure that we have all the necessary hardware and it's all thought out, because I know there was a few issues that we had with you about the hardware that we needed. And we really didn't have all the technology we needed, so we really need to go back to the drawing board and really see all the technology out there available for this.
Thank you for coming together today. I look forward to working with you both in the future. As discussed in our case study, many challenges were brought up as the process of implementation occurred. Similarly, the summary written by Tim Key addresses issues that commonly occur in how we can ensure sufficient interoperability and coexistence among products and systems as well as the users. Because so many issues do happen, I will discuss one important issue that needs to be addressed. Workflow needs to be considered by both currently and in future upon new implementation. Our case study underwent workflow delays after barcoding began to be implemented. Because of this, the system was negatively perceived by key players involved. Tim Gee suggests some key criteria to consider prior to implementing a system that affects the workflow. Roles and responsibilities should be defined between affected individuals. The histologist's work was delayed, and this was unexpected. They should have been prepared better to expect a slow implementation process. The schedules of the vendors should have been tailored better to the workers. Project delays occurred, and this should have been expected before implementation. The overall planning of the implementation should have emphasized product designs and implementation methodologies.
In Chapter 7 from the Hit or Miss book, a community hospital implemented a barcode medication verification system to improve tracking of medications and support safe medication administration. However, it was unsuccessful due to the fact that there was a lack of support from IT and facilities engineering, a lack of collaboration between nursing and IT, lack of involvement of the hospital's IT department, and lack of knowledge. As you can see, there's a correlation between these two cases as both systems essentially wanted to implement a new barcoding system to improve workflow and the quality of care. However, the lack of resources, knowledge, skills, etc. caused the system to fail. In order for both systems to succeed, proper planning should have been done to ensure that an improvement of workflow would be present. In addition, all key players should be involved, collaborative, and knowledgeable in order for the system to be successful.
In Chapter 15 from the Hit or Miss book, a large academic medical center implemented a new informatics system for their repository systems, with a goal for clinicians to be able to review repository data, maintaining access to data in other systems. However, it was unsuccessful because of the ridiculous extended periods of time needed for clinicians, a large amount of dislike for the new system, and data collection became very time-consuming to nearly impossible. As you can see, there is a large relation between these cases, as both cases attempted to implement a system to improve workflow or efficiency of their organization. However, both were unsuccessful, as in both cases, many of the workers involved had believed that their previous system was not broken and didn't understand the attempt to replace it. In order for both of the systems to have been successful, they need to ensure more involvement for clinical staff right from the start of planning to switch systems.